Hello everyone. Today's video is about trying to heal or resolve leptin resistance issues, which is something that relates to weight gain that's otherwise kind of inexplicable, or weight retention that's otherwise inexplicable. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question that was submitted reads, could you please address how to heal leptin issues? I think it is from my leptin receptors being affected in my damaged brain due to CIRS, which is chronic inflammatory response syndrome, commonly caused by mold illness. I eat very clean and careful, so my weight gain has nothing to do with quantity of food. But since getting out of mold and trying to treat the CIRS, MCAS, which is mast cell activation syndrome, and post-concussion syndrome, I gained 25 pounds right away. I am just now able to walk 20 minutes every day for exercise, but are there other things I can do to help? Thank you so much. So thank you for the question. I'm sorry to hear about all the health issues. I'm really glad to hear you got out of mold and you're on your healing journey, and I hope you're doing just fantastic ASAP. It's a really good question. In terms of like the direct question here, to answer your question directly, is there a way to heal leptin issues or leptin resistance? Just so folks know, for context, leptin is a satiety hormone. So when we eat, once we've had enough food to eat, then enough leptin is released into the body, and then that leptin binds to receptors in the brain called leptin receptors, and then those, when the leptin binds to those receptors, it basically tells our hypothalamus and other hunger-related systems in our body to say we're not hungry anymore. And then it also has a spillover effect, to my understanding, on your overall metabolism as well. So kind of kicking into gear processes that would be involved in actually, breaking down and metabolizing that energy. So if people have leptin resistance, then they just don't get those signals for that they're full, so they're going to have a tendency to overeat. For a lot of folks, in my experience, folks who eat more carbohydrates tend to be more prone to developing leptin resistance issues. So when we do blood tests to measure leptin, so how do you know you have leptin resistance? Well, you get a blood test, measures your leptin, and if your leptin levels are too high, then that's indicative of leptin resistance. It's a good question. I've had, unfortunately for the patients that I've seen quite a few patients who seem to have this issue. They have these chronic health issues, whether it's related to mold or other things that might cause neuroinflammation. Unfortunately, some folks have, a triple whammy of CIRS and MCAS and post-concussion syndrome. Some people have Lyme and co-infections on top of that. Some people have heavy metals on top of that. So there are, unfortunately, that's nothing to say of like mental, emotional stress, trauma. So a lot of things can cause neuroinflammation, and that seems to be an underlying driver of this leptin resistance issue. Now, in a case where diet's already been addressed, shall we say, person's eating a healthy diet, not overeating, doesn't seem to be a quantity issue. So even if the person has kind of overcome that leptin resistance, kind of false signals of like, oh, you're still hungry, well, I'm not going to eat because I know I have enough calories going down the hatch, then it's really frustrating when a patient, is doing all the right things diet-wise, they're working to heal the underlying or resolve the underlying neuroinflammation, and yet they're still, retaining this weight, not losing that weight, maybe even gaining more weight. So what I've found is that I've had a number of patients where over time, as they're working with their protocols, they're getting rid of, getting out of the mold, treating the internal mold, detoxifying all of that, treating their infections, treating whatever the root cause factors are, and at least working with a, moderately strict diet, say like, a maybe 75-80% strict paleo diet, which I would say is pretty strict by a lot of standards, but not like nearly as strict as something like a low leptin diet or a carnivore diet or something like that, or modified keto diet. In many cases, the patients will find that their metabolism kind of comes back online, and it starts to do better, and they start losing the weight, and maybe it's not going, pounds aren't falling off quickly, but they're moving in the right direction again. So that happens, I would say, in a majority of cases. For the unfortunate folks who are not in that majority, say the other, 20-25% that aren't in that group, then in many cases, if they go on to say work with a stricter diet, such as the ones I mentioned, like carnivore, which is very, very strict, modified keto or whatnot, low lectin, then that will usually be enough to kind of push them in the right direction. But I've certainly seen number of unfortunate folks who are doing all of that and then some, and they're still not losing weight. And as best I can tell, the factor that seems to be the most important in those patients is working with things to help try to increase their muscle mass. So in other words, if all the root cause stuff has been addressed, the mold's gone, detoxified, heavy metals are gone, infections are gone, everything's been dealt with, and the diet is really on track. It's a very it's a proper amount of calories getting down the hatch, not eating too many carbs, eating a low carb diet, like modified keto, whatnot. If all that's in place and the weight's still not coming off, then it seems to be a muscle mass related issue. And in many of these patients that I see, they've been sick for a very long time, a few years, if not several years, if not getting into decades, and they've just not been able to keep up their muscle mass because, go figure, internally their muscles, which are heavily dependent on mitochondria, their mitochondria aren't working properly, so they're struggling from that regard. Plus, they haven't been able to be as active as they've wanted to be because they're spending too much time, needing to spend too much time, sitting on the couch, lying in bed, just not being that physically active. Or maybe they can, they push themselves or over time, like able to start, walking and things like that, which is wonderful. Walking certainly provides health benefits, but one's really not going to maintain optimal amounts of muscle mass or gain additional muscle in a really meaningful way by walking. Like, yes, your walking muscles will be fine, but you won't really experience much muscle mass gain. And it seems that for a number of folks, and not just folks with a history of complex chronic illness, but also for folks who are just, have regular old health problems, like, a little more creaky than I'd like to be, or my brain's not working quite as well as it did, in my youth, or my energy levels aren't quite where I want them to be, or I get headaches from time to time, or have some IBS or whatnot. Even for folks like that who have a lot, most sometimes have notable issues with losing weight, they're putting on weight or having trouble losing weight, and so whether one's chronically ill or have a history of chronic illness with leptin resistance, or there's less complex case, in my experience, my growing experience, folks who are having a hard time with weight loss, it seems that muscle mass optimization is really, really important. And it's something that I've been observing in my practice, and it's something that I've been hearing more and more clinicians talk about as well, whether it's on podcasts or whether it's on my podcast and I'm interviewing somebody, or it's listening to other people's podcasts. And then there's also discussion about this at some of the complex chronic illness conferences as well, talking about these sort of metabolism issues and how muscle mass is just so important to get that back online. That's oftentimes a stumbling block. It's always hard to comment in much more detail, not knowing all the details about a given case, the person asking the question here. But by the sounds of it, it sounds like there's been a lot of health stuff going on. So maybe the sort of internal healing work is not far enough along for the leptin resistance to start getting better, or maybe it is largely rooted in needing more muscle mass. Again, that's great when a person's like, okay, I'm finally able to walk for 20 minutes every day, which going from 0 minutes or 5 or 10 minutes all the way to 20, like, that's great. For a lot of folks, that's a big accomplishment given their health issues. So not casting any shade on that at all. It's great, but when a person is able to start, so if I had a patient and they were able to do, say, 20 minutes walking a day, and it's like, I'm still not losing weight, what's going on? My diet's right, I've got all these things in place. I would chat with them about trying to figure out at what point could they bring in some resistance training to try to get some of that muscle mass back. And it might be as simple as like, I'm going to just do a couple of reps for a couple of body parts with a really light weight a few times a week, and that's it. And it will take a while to get that muscle mass up, but the body, thankfully has a really good memory when it comes to putting muscle mass back on. So if we've lost our muscle mass, we can regain that lost mass a lot faster than building it from scratch out of the gate. And then, of course, folks can build more muscle over and above that, but it's sometimes quite slow and steady getting there. But yeah, it's really that muscle mass piece that I think is the missing piece of the puzzle for a number of folks. And again, I'm seeing in my practice that seems to be the case. Now, one of the things that is important to tie in there as well is making sure that one's getting enough dietary protein to actually facilitate muscle gain and muscle maintenance as well. And especially as we start to get a bit older, and older is a relative term, of course, but by the time we're above, say, the tender age of like 50 or 60, depending on one's genes and constitution and all of that, then making sure that we're getting enough protein is really important. Again, at conferences, podcasts with very brilliant docs being interviewed, different courses that I've done, like it seems that a lot of folks are talking more nowadays about like fairly high protein intakes, especially when we get above that age of say 50 or 60. So kind of in the realm of like 1.5 to 2 grams of protein per pound of ideal body weight, not per kilogram, but per pound, which is a lot of protein. So I mean, my jury is a little bit out on whether that's necessarily necessary across the board for folks above a certain vintage, but it's sometimes another stumbling block that I've run into is folks just aren't eating enough protein. They're like, oh yeah, I'm eating maybe my like standard, like 0.7 grams per kilogram being 2.2 pounds, so so like it's 0.3-ish grams of protein per pound of body weight, or 0.7 give or take per kilogram of ideal body weight. It's like, oh, so I'm eating enough protein. Well, it might not be enough protein for some folks. They might need to notably increase that, possibly doubling it or tripling it or whatnot. So that's another factor to consider too. One, making sure that they're getting enough protein. But again, you have to talk to your clinician to get specific recommendations on that. I thank you for submitting the question. I wish you the best moving forward. I hope everything's all cleared up for you very soon. If anybody has any questions on this topic or comments on this topic, if you've had experience with gaining muscle mass and that helping, or maybe you put on a bunch of muscle mass and you're still not having success, please consider sharing in the comment section. Folks read the comments, and it's just a way to share experience if you're comfortable sharing it, of course. And if anybody has any questions on any other topic, please post in the comment section below, and I will do my best to answer as soon as I can.